diving a little bit deeper, right, into this aspect of customer experience, customer delight, right, especially in such a outcomes-driven business, right? Maybe we start a little bit with a first principles view, right? I'm sure it's an obvious thing, but it'd be great to get your take, right? Why do you think customer experience or customer delight is something that's so important, right? How does it like really help to shape the image of a company, a business, a brand? And why is it so critical for a company to succeed? And then maybe we jump a little bit more, into trying to understand how you measure customer success, how you can impact customer success, right? How you train people to become customer centric in the company and so on and so forth. But maybe we just start off with that first idea, right? Grounding it. Why is customer experience important? How does it shape a brand? Why is it essential for success?
Yeah, so I think, and I'm going to talk. And Rohit's been part of Bito's journey for a period of time as well. So he will resonate with it when I tell you, and I'll be very open and candid of the things we were doing and we needed to change to be able to be where we are today. But customer experience, I would say, in any business or any company is extremely important, but more so in healthcare because it's about trust and consistency, right? So, trust, if you lose once, it's going to be very difficult to regain, especially in healthcare because you're dealing with a person's health and eventual outcome. And consistency of your experience also matters because you can't have a shoddy experience and then a great one and then another shoddy experience and a great one. It needs to be consistently good, right? When I look at especially our journey, and I can talk to you at length about customer experience, but I'll keep it quick and short. uh, we didn't realize the importance of customer experience early on in our journey, and so many of these things are coming from our learnings. We didn't really, unfortunately, have ops matter or such forums when we began, where we could get initial inputs and guidance, but we didn't design customer experience. I would say we designed for business at first and then at ops and then customer experience. I think it should have been the other way around. And especially now, any new initiative that we undertake or the previous ones which we are revamping have customer experience at the core. But I'll take the example of the devices, right? So what we did was, obviously there were always going to be pressures of revenue generations, etc. So as soon as and our ops weren't at that point in time designed to account for both scale as well as, and I'm talking about the digital core, maybe few years back, they weren't designed for scale. Neither they were designed for customer experience to be excelling, and as a result, we used to end up, let's say a person used to start monitoring. If you look at our reviews maybe 5 4 5 years back, and I'm sure Rohit would have as well in his diligence, we used to end up calling people and calling people to sell and calling people to do this and that. So there was hell of a lot of calling, but not segmented calling. There was no thought as much behind it. But then, we took a step back. We said this is not what we were planning to build in the first place. So yes, it may cause a short-term pain in terms of stepping down, in terms of our growth or revenues, etc. But we want to fix, or we must fix our customer experience first, because forget about healthcare or anything. As a business, we stand for delivering a promise to the customers, and we worked really hard at it. So we brought down pretty much, we segmented, automated a lot of things. We made sure that we set up multiple warehouses across India to deliver, and I'm talking of several years back when Vito was typically a remote monitoring and management of diabetes company. We uh, we did so many things that always centered around the customer, that in a short span of 7 8 9 months from when we began, we cut down on the calling. Started doing segmentation. We ensured that warehouses were set up. We ensured that every inch of a negative customer feedback was getting addressed proactively. We were acknowledging that there were mistakes on our side, solving for them, etc. We used to rank, if you look at these ratings on Amazon, etc., as one visible metric. We used to be around 3.8 or something sometime back for these devices. Today we are the best ranked monitoring solution at 4.4. and that's happened over a short, and we already have like had already thousands of ratings, so it was cumulatively not going to be easy to move from the needle from 3.8 to anywhere close to 4. But the team worked so hard that in a short span of 9 to 12 months, we were hovering around 4.1, 4.2, and then now if you look at it, close to 4.4, we are bestsellers, etc. And not just for the device, for the solution entirely. The same thing I would say, also on a coaching side and on the doctor's side. So we take that naturally extremely seriously, because that eventually is boiling down to our health outcomes, and those are what we stand our ground on. And initially, when our coaches used to talk to the patients or the doctors, the SOPs etc. were not so well refined, and even when the SOPs were refined, the adherence to those SOPs was not great. So again, we worked really hard to make sure that the patient experience was at that center. And I'll tell you a small thing. About a year or so back, it used to take us. So when a person bought our care program, a care program is basically like a subscription program, and you would get access to the doctors, you would get access to the coach, you would get all your medication, etc. And it's a full blown program management of the individual for a span of 3, 6, or 12 months. Now, when a person bought that program, by the time, so typically the SOP had, hey, you get buy the program, you talk to the coach, you talk to the doctor, you get your medicines. By the time the person talked to a doctor was 8 days. By the time he received his first medication was 15 days from the time he had bought. So you can imagine he paid 12, 15 grand, and then it was taking 15 days for the first service, and we were up knocking on his door for renewals right on the day of 3 months when the sale had happened. So we realized that there were some simple problems to solve, somewhat more difficult problems to solve, but they were all ops problems. So earlier, what we used to do was there used to be a relationship manager calling, then after that the coach calling, and then the doctor getting on a call, etc., etc. We squeezed everything. We allocated these at automatically. We matched basically patient profile to the coach and to the doc. We built an algorithm, and instantly when a sale happened, the coach and doctor were allocated. Now, from that 15 day of medicine delivery, we deliver medicines in 3 days. From that 8 day of doctor consultation, it happens within 24 hours of you having bought the program. And it is only so we always had the tech, but we didn't use the tech to drive customer experience and customer experience through an ops efficiency. So I think those are two examples which I can take, one from the product side, one from the service side that we had. And that is one of the reasons, whether it is customer satisfaction. See, NPS and customer satisfaction are always, or your these ratings on Amazon are always going to be the output of that engine or the control system, as you know, some of you may be engineers here. But there are lots of inputs that go into it, and then the output is what it is. It is an outcome or an output. But I think as founders, it is very easy for us to forget about the inputs and obsess ourselves with the output. And yes, while we should, but inputs are actually what will get us to the output, and the right inputs will get us to the output. And hence an NPS. Now we enjoy great NPS, we enjoy great customer satisfaction, but it's not because we wished for it. We did wish for it. For a few years, we continued to wish for it, but didn't work towards it. But now we wish for it, but work towards it proactively, and fortunately, we've achieved many of those.
Awesome. I think this entire attitude of worrying about what are the correct inputs that you should focus on, and really take a look at, and that's what you use to drive your outputs on the customer experience entire journey of it. That's, I think, something that a lot of companies miss. Like, what are the exact areas that we should be looking for? Like, where are we getting those essential customer feedbacks from? Is it going to be through Amazon? Is it going to be through, let's say, angry emails from customers? Where is it that you look for, right? So I understand that at Bito, you have also been through an entire journey for this, where initially you, as you were saying, that customer feedback, customer experience wasn't an entire focus of it. But then
Yeah.
you started realizing that the better the customer experience is, and the better your ops is, arranged around it and catering to it, the better your health outcomes is. because if your patients or customers, they have those strips ready, they won't be frugal about it, they won't skip a day of testing, you will have better real time data. So as a result, you'll basically give them better treatment and better service essentially. So when you talk about this customer feedback, the input part of it, how do you go about how did you go about building this for B2, right? Where did you understand that this is where I will get my meat of customer feedback from? What was your approach in that, and how were you measuring the entire customer feedback around it? If you could shed some light on that.
Yeah, so it's basically a culmination of a you need to know that you're not perfect, or you need to start acknowledging that you're not perfect. So as founders, we are eternally optimistic, and we seem to think that what we are doing is the best thing, and maybe the customer doesn't know about it. And that's sometimes the case, but mostly what the customer's telling you is is writing on the wall. And if we choose to ignore it for whatever reason, sooner than later it will come back to bite us only. So we keep all channels. I think that's the most relevant thing. I think customer, we roll out anything or we do anything, and if the customer is not happy with it, we need to go back to the drawing table and figure out why it is the case. And that of course starts telling into all business metrics, if not now, then in a few months time. And for us, of course, we have a great team, of customer experience. We across all channels, whether this be social media, whether this be our app. So we capture a lot of NPS information from the app itself, customer satisfaction around monitoring. We capture customer satisfaction for our doctors. We capture customer satisfaction for our coaches on multiple aspects. So these are what the customers telling us, and then we audit ourselves on customer experience as well. So we have a strong both audit team, as well as now we started to use some AI tools to help us fasten that, because some of our, for example, the coach calls last for 30 minutes now. That creates a little bit of a bottleneck if there is an individual doing the audit. So there we're using some tools that are available in the market. And these allow us a combination of these things. So if an email comes to me, I never ignore it. Now fortunately I don't get too many, but when it does, I think that's really the alarm bells, because if it has come to me, that means there's something really wrong. Or we've troubled the patient so much that they nobody wants it. Everybody's living in a busy world. If a product they paid for, or a service they paid for, performs that the way it should, I don't think they're really perturbed of reaching out to you unnecessarily. They're not doing it for the heck of it. Of course, it is true that happy customers will seldom tell you. The unhappy customers will tell you a lot more. But that's why I think, while so one is a little bit of self-fulfilling prophecy. If I surround myself with just the happy customers, it won't help my cause. So I at least make sure that if even there is an iota bit of, even if there's one customer, let's say last week, we have about 20 odd doctors, and we look at even the doctors customer satisfaction scores. But even if there is one dissatisfaction, or like a score that says one customer was dissatisfied with this doctor, we don't take that lightly as a feedback. We go, for instance, myself, Dr. Navneet, who's our chief clinical officer, Rohit knows him well. We listen to that whole call. There aren't too many, which allows us that bandwidth to do it ourselves. And then we counsel the doctor if there was genuinely a challenge there, right? So it is, I think it also stems from the top a little bit, if especially if you're a little large organization. I mean, when it was very early on, then everybody could focus on this. But if I don't honestly believe and work towards customer experience and look at, it's a little bit leading by example. If Dr. Navneet didn't care about the fact that he said ये patient ही ऐसे होते हैं, you know, उनको समझ नहीं आता है, डॉक्टर तो अच्छा बोल रहा था, बट पेशेंट ही ठीक नहीं है. अब पेशेंट ठीक नहीं है का क्या मतलब है? मतलब हम लोगों ने उसको कुछ चैलेंज दिया ना. So that's how at least I approach it. The second thing is, with tech, I've had this challenge lots of time in my We have this friendly banter now with Kunal, who's my co-founder and CTO too. But uh, for his team at times, so they will build a feature and they will build it as a functional for functional work. But it's very difficult for a tech person to acknowledge that what the customer is saying is not right, is correct, and that feature or whatever functional UI they may have built is not the right one. So just acknowledging and accepting that if there is a problem, let me first be Sherlock Holmes on myself, then on the customer. I think that attitude is extremely important for most people in the top, and then it percolates down, and then you can build your systems around it, like we have tried to build. So we are very proactive. So we don't just, for example, look at कि Amazon पे कितना sale हुआ. We look at the comments, we look at the reviews, we look at our BSRs, and then we also look at कि scale हुआ कि नहीं हुआ. Or there are different issues, like at times, of course, one of the other competitors may market hell of a lot, and then our from BSR 3 or 4 we may have followed, bestseller rank we may have followed. But the other attributes we know. So what is controllable by us, we focus on that. What we can't control, we can't control. I mean, and now, at least on the digital business, we've understood some of those things very well. On the clinics and the physical side, we are still learning. So we don't know certain things, and we can anticipate and accept only a few. But then over the course of the next year or two, we'll figure out more or less every variable that is there that impacts customer experience. And potentially we may have solved it, otherwise we may be in the process of solving. But at least in the digital core, to a large extent, we figured out what those variables are, and we keep a view, very solid, strong view on those. And even if there is one or two of those issues, so this calling thing, which I was telling you earlier, we had like maybe 100 over 100 DNDs in a month at that time. Now last month there was one. बट इट्स नॉट लाइक वी गिवन अप कि अब हम लोग देखते नहीं है, क्योंकि पिछले काफी महीनों से एक या दो आ रहा है. तो ऐसा नहीं है कि वो डेटा नहीं देखते हम लोग, हमें वो देखना है. मतलब कभी नहीं पता कि फिर से वो 2 या 3 या 4 5 कैसे बढ़ जाए. So even if it is one, we take a conscious view on it. And why was that one also there? Of course, then it's a law of probability. You can't just achieve 100% compliance on everything.
That's amazing. I think having this rigor, that pursuing every last bit of issues that the customer has and trying to solve for it, I think that rigor is something that's truly essential to driving great customer experience.